Good morning, everyone. I am Dr. Moyal Ajit Daptadar. I am from Goa, and you heard from me before as well. But today, I am going to speak on behalf of my colleague Dhamavai Shetty on his presentation on rabies in wildlife and domestic dogs and One Health in Action from the Middle East. This presentation has been made collaboratively through VOA headquarters colleagues Dr. Rachel Tidman, Dr. Gregory Herman, Dr. Jingwen Wang, and Dr. Paolo Tizzani. This is a classic example of collaboration. So, introduction. So, why is rabies called a One Health problem and why is there a One Health solution? Rabies is a zoonotic viral disease and it affects the central nervous systems. And if we do not have a post-exposure prophylaxis, it will definitely lead to death. It is a classical One Health problem because the impact is directly in human population. The problem is in animals. It's in domestic animals and wild animals, and there is a large group of animals, large range of species which are affected by rabies. And therefore, we need to have a collaborative One Health solution to address this problem. What is the epidemiology of rabies? And why is it important to understand the epidemiology of rabies? It is important to identify what are the key species, what are the key reservoir species, and understand the dynamics of disease transmission and how and what control measures can be used for my problem area, and how do I plan an effective intervention to address the disease in my country. What is the epidemiology of rabies and One Health? So, rabies is present around the world except in some isolated locations like Australia and Antarctica. But rabies is endemic in many parts of the world. If you see this page, you can see what the WOA reporting done through WAHIS. So, this map represents the global rabies situation as per the members reporting to WAHIS and this was last updated in 2024. So, if you see, rabies is absent in the green countries, and then there are some countries which are in blue color and they have self-declared rabies free, to be documented rabies free, uh, and this self-declaration can be done through WOHA. And then we have the areas in orange, and this is where the virus is present. This slide represents the early warning system of WOA, and the red dots indicate all the areas where rabies has been identified and reported in the wildlife species. The area in orange and green are all those areas where rabies has been detected in dogs and other domestic species. And in the last 7 years, there has been no outbreaks reported from GCC countries. So this is something for you to get back and check if there are any other cases of rabies in your population, either domestic, wildlife, you can report it to WAHIS. So what are the reservoir host species and transmission dynamics for rabies? So rabies virus is quite similar to Lisa viruses, and they have a wide range of mammals who act as a reservoir, and the WIS virus can only be detected after the onset of clinical signs. And currently, we are aware of two cycles which exist in the nature, two transmission dynamics. One is the urban cycle and the next is the sylviatic cycle. So the urban cycle, dog is the most important host animal. It is the one responsible for transmitting disease to humans and sometimes even in wildlife. And the sylviatic cycle is important in the wildlife population, and the wild animal is responsible to transmit the disease among the wild and other animals, and sometimes they can also infect the domestic species, and therefore these two cycles can be interlinked. It is suspected that species from other orders like domestic dogs and fox, especially from the order Carnivora and Chiroptera, are usually maintenance or reservoir host, and many mammals are including humans are the dead end host and most susceptible to rabies. And this group of susceptible animals include cattle, sheep, goat, donkeys, camels, and wildlife. Domestic dog is definitely the primary rabies virus destroyer globally, and it is responsible for 90% of human rabies cases. The epidemiology of the reservoir host in and the transmission dynamics in Middle East is not very well understood. And there is a need to improve the understanding of the reservoir host and the communities which are affected, and the host communities and transmission cycle in the Middle East. And we need new evidence and a local perspective for this bit of information. The epidemiology of rabies is definitely complex, especially in Middle East region, because we have a huge diversity in this area. However, there has been a study in 2015 which has characterized that rabies has four genetically distinct clades with separate origins, indicating regular and multidirectional transboundary movements, with some areas experiencing relative isolation. The main reservoirs for rabies in Middle East are therefore domestic animals, particularly dogs. But there are other wildlife animals such as red foxes and golden jackals which have been implicated in the transmission, and this could vary from country to country. Wildlife species, particularly carnivores, play an important role in the epidemiology and in the population dynamics. Therefore, Middle East has a huge challenge in preventing and controlling rabies due to a transcontinental nature, diverse politics, culture, economic landscape, and most importantly, a severe lack of comprehensive rabies surveillance data in the humans and the animals both. What is the significance of foxes in the region with respect to rabies? Foxes could play a significant role in the wildlife ecology of rabies. They are mostly driving the sylviatic cycle, which is responsible for transmitting the disease from wild to other wild animal and wild animal to dogs or other domestic species. They might act as a reservoir species or may be involved in transmission of the disease to other animals. Wild canines like foxes can transmit the virus either through bites or through their saliva. What is the One Health impact of rabies? So, as you might be aware, there are almost 59,000 human deaths which occur globally, and the poorest regions in the country are the greatest risk of this disease. Till now, there has been, as per the evidence presented in 2050, 3.7 million disability adjusted life years and 8.6 billion USDs as an economic loss every year. And remember that rabies is a completely vaccine preventable disease. Despite being a preventable disease, there is a lack of investment in prevention of the disease, especially in dog vaccination and and also in accessibility to the post-exposure prophylaxis in humans. One of the important impact of rabies, domestic rabies, is also wildlife conservation. It definitely affects those species which are at high risk of extinction. It's also a threat to wildlife conservation and biodiversity. And the rabies outbreak in a wildlife population can definitely affect a vulnerable wildlife population and therefore impact the species conservation efforts. And infected wildlife can further transmit rabies to other animals, and including domestic dogs and wildlife, and therefore is also a huge loss of biodiversity. What are the control and the mitigation strategies? So, what are the strategies for controlling in wildlife? Uh, if there are two type of population. If there are sympatric dog population, that is two type of species living in the same geographical area, then large scale vaccination effort is crucial to prevent rabies, and then importantly followed by a dog population control and management, and this will reduce the burden of rabies in wildlife. Then you need to improve the surveillance and reporting of rabies in wildlife so that we understand who are the reservoir species and what are the transmission dynamics and what intervention we can plan. The vaccination of reservoirs or transmission hosts. Example, you can use the oral rabies vaccines for foxes and other terrestrial mammals. ORV has been used extensively in the European countries to address the wildlife rabies. And there have been several countries who are interested to use ORV in their domestic population, and there are several pilot studies which are ongoing globally. And you will come to know more about ORV on day 2 when we have Dr. Thomas Mueller. He'll be speaking about his experience on ORV. Uh, then the next strategies for wildlife is monitoring and targeting the wildlife reservoir species to reduce the disease burden. In collaboration with the local authorities and the wildlife organization, strengthening collaboration between the veterinary and the public health sector. So in summary, vaccination and population control measures are the strategies for controlling rabies. It is important to have a large-scale vaccination drive primarily aimed at sympatric dog population. A large-scale vaccination is important to prevent the transmission of rabies. Vaccinating a significant proportion of dog population can help create a barrier to spread the disease. So almost you say that 70%, vaccinating 70% of dogs can help you in elimination of dog mediated rabies from a geographical given geographical area. And then the next aspect is controlling the dog population and dog population management, which is an important measure in preventing rabies transmission. And reducing the number of stray dogs or unvaccinated stray dogs can help you minimize the risk of rabies outbreaks. What are the challenges and solutions? So, key challenges. First, for the wildlife reservoir species, we need to understand which species are acting as a reservoir species in wild, and it is therefore important for controlling this disease in these species. We need to recognize the threat posed by rabies to wildlife for the species conservation and biodiversity. We need to improve the surveillance system and implement effective control measures for early detection and prevention of rabies outbreaks. What are the solutions? We need to improve collaboration between the wildlife organization, veterinary authorities, and public health agencies to develop a comprehensive strategy for rabies control. Most importantly, we need to improve surveillance. We need data. We need evidence on what is the current problem. So having advanced surveillance techniques including molecular epidemiology, geographical information system GIS, and to monitor and track rabies cases in wildlife and domestic dog population is quite important. And also remember the community is a very strong stakeholder in prevention of rabies. So educating the communities about the importance of responsible pet ownership, prevention of rabies, and the benefits of vaccination is quite important. And the capacity building. So you need to provide training and resources to your veterinary professionals and wildlife conservationists to enhance the skills in rabies prevention and control. So the conclusion, rabies is definitely a neglected disease and it has a wide scale on health implication, primarily affecting you, that is us, humans. Reservoir host and transmission dynamics need to have a better understanding. Large scale vaccination drive is always and is the most important measure to control rabies, and this is supported by a dog population management methods. Rabies is therefore a preventable disease, and improving the knowledge and the funding could be the answer which you're looking for. So to effectively control and mitigate rabies, you could continue surveillance and improve surveillance to detect the rabies cases in both wild and domestic dogs. Conduct vaccination. You can use ORV maybe, or you can use the parental vaccines in dogs. But vaccination is the most important tool for rabies elimination. And dog population management. Implementing effective dog population control measures such as sterilization and responsible pet ownership programs are quite crucial. Then awareness. You need to improve the awareness. If people don't know what is rabies, if people don't know what to do after having incidents with an animal, uh, it is going to be a moot effort because these people will not go towards getting the post-exposure prophylaxis, and then you will not have the data. So you need to improve the awareness of the public and educate them about responsible dog ownership, responsible pet ownership actually, because you can have different type of pets, how to prevent rabies in dogs and how to prevent rabies in humans. These are the key awareness messages you need to generate. And by taking these actions, there could be a significant progress in reducing the burden of rabies in human, domestic animals, and wildlife population in the Middle East region. Thank you for listening to me, and thank you for allowing me to present on behalf of Dr. Dharmavai Shetty. If you need to, if you need to have more information on wildlife rabies, you can contact Dr. Shetty at this email address. If you have any more questions, you can even contact Tariq and he will reach out to us and we will get back to you. Thank you.